Welcome, everyone. Good morning. It's great to have you here. I'm Kevin Watkins. I'm Director of ODI, and I want to welcome all of you to today's event, Mental Health, the World's Forgotten Crisis, and I think a very aptly chosen title. The event is part of our Global Challenges series, which tries to shine a spotlight on some of the world's most critical development issues and some of the most forgotten issues, such as the one that we're discussing today. As well as those of you here in the room, we have several hundred people who are joining us online from different parts of the world. So I'd like to welcome all of our online viewers. We've just had to introduce Alastair to the concept of our hashtag and Twitter tag. So the Twitter handles are shown on the screen. It's hashtag Global Challenges. So please do tweet vigorously throughout the morning. As many of you will know, this week is UK Mental Health Awareness Week, and so I'm very glad that we're holding this event here in ODI today, because the mental health deficit is clearly of crisis proportions here in the UK, but it's also a systemic crisis across many of the world's poorest countries. We had a discussion before we came in about the statistics, but it's widely argued and cited that mental health disorders affect around 1 in 10 people at any one time, and 1 in 4 of us over a lifetime. But of course, mental health is a problem that can affect anybody at any time, and that's why we need a system there to provide the public good of protecting all of us, all of us in society, rich countries and poor countries, from the threats that are posed by mental health problems. I have to say, partly as a mea culpa, that in preparing for this, I actually realize how little attention I personally have given to this issue over many years of working in development. If you look at the headline numbers and the figures that are widely cited, that depression and mental health disorders, if you measure them by disability-adjusted life years, which is one of the measures used by the World Health Organization and the World Bank and others, it's actually the single biggest cause of lost life years. It's argued that mental health disorders cost around 4% of GDP, and we have just under 1 million suicides every year. Now, these are all macro numbers, but if you think of the everyday realities, the 20% of women who are depressed post-birth, who are trying to raise children, of teachers who are trying to deliver a vital service, who may be struggling with depression, of people whose productivity is undermined or whose livelihood is diminished because of depression. So this is a problem that goes right to the heart of the quality of life, to ideas about fundamental rights in health, and which clearly has a profound bearing, not just on human well-being, but on economic efficiency and productivity. The fact that we haven't attached sufficient weight to the problem, I think probably speaks to some of the perverse incentives and rules and codes that guide our sector. If I'm being honest, in ODI, I checked last night our publications list on this issue. We now have a fantastic new publication, but we don't have a big back library in this area. And so I think that speaks to the fact that the research community in development, with the exception of many people in this room, clearly haven't attached sufficient weight to the issue. If you look at the non-government organisation agenda, I think it would be fair to say that our major NGOs haven't really taken up the issue and got it on the international agenda in the way that they have with other health concerns. And I'm thinking here of malaria, tuberculosis, HIV, AIDS, and so on. And it's also the case that philanthropic organisations, the private sector, hasn't addressed it in the systematic way that it merits. So I'm absolutely delighted to say that we're launching a new report today, Mental Health Funding and the Sustainable Development Goals, which I hope will do two things, which is, first of all, to fill a gap out there, and secondly, set ODI on a course of taking this issue up in a much more systematic way in the future. Jessica Mackenzie, who's the author of the report, is here on the panel, and she'll be speaking to us a little bit later. I also want to give a very warm welcome to Dixon Chabanda, who's come over from Zimbabwe to be with us. He's an honorary research associate at King's College London's Institute of Psychiatry and a senior consultant psychiatrist in Harare. Dixon has worked in several African countries as a WHO consultant on mental health legislation, human rights and policy development. He set up the Friendship Bench project, which aims to reduce the mental health treatment gap in Zimbabwe, and he'll be talking to us about that a little bit later. I'm also delighted to welcome Fode Sawi Lahaye, who's joined us from Sierra Leone. He's a former First Deputy Minister of Health and Sanitation in his country. And I think he's incredibly well placed to talk to us about some of the mental health impacts of the Ebola crisis in his country and other issues. So we look forward to hearing all of your perspectives a little bit later. Before I turn to you, however, it's my great pleasure to welcome someone who I suspect many of you have recognised already, who's Alastair Cambpell, our keynote speaker. If I read Alastair's CV, we'd be here an awful long time, so here's the abbreviated version of it. He's a writer, communicator, best-selling author, and political strategist who's well known for his role as a former advisor to Tony Blair and a press spokesperson for Tony Blair and Director of Communications and Strategy in Downing Street. I should also say, and the reason he's looking, I think, pretty chuffed this morning is that Burnley is the football club he supports, has recently been promoted.
It's not funny.
It's the closest I could come to a joke, Alice. give me a break here. In recent years, he's been increasingly involved with mental health charities and causes. He's a former Mind Champion of the Year, an ambassador for the Time to Change campaign to raise awareness about mental illness, an ambassador for Alcohol Concern, a patron of Maytree, the country's only charity for the suicidal, and of Kids Time, which supports children of mentally ill parents. There are books outside which you might want to look at after, and if you purchase any of those books, the money will go directly to Time to Change. Alastair co-founded the all-party campaign, the Equality for Mental Health, which was credited in Parliament by Chancellor George Osborne with securing an extra £600 million of funding for mental health services in the 2005 spending review. Alastair, it's a huge privilege for us to have you here. So if I could pass over to you to speak to us. Thank you.
Thank you.
Thank you.
Right. I think, first of all, in the spirit of rebuttal, George Osborne was not Chancellor in 2005. I think we mean 2015. You're just wiping Labour government out of history. So, yeah, and all the rest of it was all broadly accurate. Thank you for that. I think the other reason of the sort of various hats that I wear, I think the hat that I wear that brings me to this issue and therefore to this event is that of kind of just being a human being and a human being who has had psychosis, problems with alcohol, continuing problems with depression. The psychosis, sorted, I think. The alcohol, pretty much sorted. The occasional lapse from time to time. And the depression sort of comes and goes, but I've learned how to deal with it. And that is, I think it's a very, very human instinct for people who've gone through stuff that they want to, when you see people running the London Marathon or any marathon, you find stories of people who get involved with things because it sort of affects them or people that they know very, very well. And of course, the other thing is that I do know quite a lot about how governments work and about how issues change and develop. And I do see this as an area where it's going to need an awful lot of campaigning and an awful lot of arguing with policymakers and with the public and with public opinion to get us to where we need to get to. So Kevin mentioned the campaign, Equality for Mental Health. And yes, it is true, and I was very pleased that George Osborne stood up in Parliament and said extra 600 million quid. But I think you'll hear from Jessica shortly that, you know, you can make the numbers look good, but ultimately it's about what then flows through, the outcomes from decisions which are easily announced and easily made, but then does it actually make the change that we want? And so the reason I love the Time to Change campaign, as if you like, as a communicator and somebody who likes strategy, is actually, it's not about services, it's about changing the way that people think. So that certain things that we see and we kind of live with and we take for granted, we actually end up no longer being able or willing to take those for granted. If you walk out of here now and you walk down that road, you won't have to walk far before you see somebody sitting on the pavement who is probably homeless, who may be an addict, who probably has serious mental health issues. And let's be absolutely honest, most of us will walk by. And we just get used to it. And I don't have, most of my experience on this is in the UK and Ireland to a lesser extent. But I went on a trip a couple of years ago now for comic relief to Ghana. And as Kevin was saying in the pre-meeting, that Ghana actually is seen as one of the better countries when it comes to mental health care delivery. And I came away thinking, well, I'll carry on raging about the injustice of mental health care in the UK, but it is as nothing compared to what I saw there. And there's actually a story in Jessica's report about the work that Basic Needs do and about an individual called Francis, who I think I may have seen, who was chained to a tree. And actually this was, I was told, was quite a common thing. And of course to us, with our kind of, you know, westernized, developed economy eyes, you think, well, how could you possibly do that to a human being? And there's the family, it's the family that's doing it. And you go and talk to them because the family explains. If we don't do that, he wanders off, and he wanders off into a culture and a society that what's going to happen to him there is possibly worse. And then I went to one of the main psychiatric hospital in Accra, and oh my God, I think about it a lot because I think those people are still there. And that the two doctors who were there and the small number of nurses who were just sort of overwhelmed by the demands of these, and you see people sort of literally, I'd never actually seen a group of people lying around with their tongues hanging out, lolling, and naked, and people who were there and they'd forgotten why they were put there. And when you drill down a bit, you find actually that they'd got into the criminal justice system, and then they were just parked there for a while for a kind of an assessment that never happened. And I thought, this is medieval. And yet we live with it, and we accept it. So I come at this from the angle of wanting to campaign for better services in the UK, because that's where I live, and that's where I'm from, and that's what I know. And we are, let's be honest, the UK is actually better at this than most countries, but we're way, way, way behind where we need to be. Equality, parity between mental and physical health, it exists. Those words exist in the National Health Service Constitution. That is the law of the land. But we know it doesn't exist. And if it doesn't exist in Britain, it certainly doesn't exist in a lot of the developing countries, and it certainly doesn't exist in the United States, still probably the most powerful country in the world. And therefore, we've just got to be honest with ourselves. We are so far from where we need to be. And how do we get to where we need to be? You get there, this is why I like Time to Change, by changing the way that people look at an issue, think about an issue, get involved with an issue. I thought it was really interesting on Mental Health Awareness Week, as Kevin said. I thought it was really interesting the other day that, in fact, I wrote a piece yesterday for the International Business Times about this, that the young royals, now I'm not a monarchist, okay, I'm what would, you have to say you're a British Republican in case anybody thinks you're either an Irish Republican or even worse, an American Republican. I'm a British Republican, but one who kind of does have a certain admiration for Her Madge and the way she keeps going. There she was in her coach again yesterday. I thought, how many bloody Queen speeches has that poor woman had to read out? But the young royals came out this week, William and Kate and Harry. And I thought what was interesting about that, the Republican in me says, why do we need these people to sort of, tell us what we should think? But the mental health campaigner in me actually thinks it's brilliant. I'll tell you why. Because the thing about the monarchy is that they tend not to stray too far from what you might call the at or close to the mainstream of opinion. So what that says to me is that this is moving, as a debate, as an issue, this is moving into a much, much better place. The fact that Kevin can say, very honestly, we've not done enough on this as an organisation. And now you are. And that's good. And I was, this week, as part of Mental Health Awareness Week, I've been at Barclays Bank. Now I think banks, politicians and spin doctors, you can argue about who's kind of, got the worst reputation on the planet. But a lot of the banks, a lot of the big financial institutions are actually really getting into this space and doing some really, really interesting and innovative stuff. When Jessica talks about her report, you'll see that on the question about who should be funding better mental health research and care, the answer is all of us, everyone, every organisation. And that's a mindset change that we've got to be part of. It's happening in some governments. It's happening, as I say, in some banks, in some financial institutions. But if I were to tell you, for example, that on the time to change front, that the National Health Service, which is one of the great healthcare systems in the world, despite what Jeremy Hunt might be trying to do to it, what's happening is that as a healthcare system, as an employer, they're not a very good employer. They're not a very good time to change employer. That's the healthcare system itself. So again, we've got to keep pushing and keep moving. And what I like about the report that you're going to hopefully take away and read and digest, you do have to base policy decisions. Governments, and here's a bit of advice about how you deal with governments and how you lobby governments. You've got to try to understand their big picture. You've got to try to understand that every single person who goes in to see a minister, goes in to see a prime minister, goes in to see a finance minister, every single person goes in there totally convinced that they're right, that their case matters, that what their cause, they really believe in it and they've worked it out. And ministers are used to that. You know this, anybody who comes in, Tony Blair and his prime ministers, not a single person came through his door who didn't want something. Might be, and often it involved money. So you have to understand that. So how do you feed into their big picture? And that's why I think that what's brilliant about this report is that, look, the moral case for addressing mental health, the world's forgotten crisis, is overwhelming. Just have to go and see that person on the street, let alone the guy chained to a tree in Ghana. The moral case is overwhelming. But with governments, you have to make an economic case as well. And I think to make an economic case, you have to have data. You have to have an ability to say, this is damaging you, not just making your country a less fair place, but a less productive place. I do this with employers all the time. I did this with Barclays the other day, because Barclays are really doing some good stuff. And I was saying to them, people should just be honest with themselves. If you're an employer and you've got 2 CVs like that, and, they went to the good schools and they went to good universities and they did really, really well. And then you get down here into this sort of middle bit and the 6 months kind of goes walkabout. And they sort of probe a little bit and candidate 1 says, oh yeah, I went off on a kind of semi-gap year and I did all this amazing voluntary work for blah-de-blah-de-blah. My dad fixed me up with this and da-da-da. And the other one says, oh yeah, I thought you might have asked about that. Well, actually, I was in a psychiatric hospital because I had a breakdown. Just be honest. Which one are you going to give the job to? And I say to these employers, I reckon you'll do yourself a favour if you go for that one. Because the thing about people who have managed to get through crisis, managed to get through a period of mental ill health and remain productive and come out stronger, they're going to be more resilient. They're going to be stronger. They're going to probably work harder. And I think that's the other thing I try to do, is to, if you like, change the prism through which we are looking at some of these issues. So that, and we use this figure about 1 in 4 of us, which I completely understand, and it's a great campaigning thing. 1 in 4 of us will at some point have a mental health crisis. But 1 in 1 of us has mental health. And that's just a different way of thinking about it. And once you actually say to people, I mean, hands up here, anybody who's never had to see a doctor for a physical health problem. Why do we go through our lives thinking that 3/4 of us, 3/4 will never have to have a mental health problem? All of us do. Grief, bereavement. I can't think of a single person that I know who's close to me that I wouldn't say at some point they've had what I've been saying to them. I think you need to get help. I think you need to get help. And the big worry I have at the moment, I said this to, I bumped into George Osborne at a TV thing recently, and I said to him, I actually, to be fair, I think they're making the right noises. I think they're talking a good game at the moment. And they are putting more money in, okay? But I'll tell you, my really big worry at the moment is that we are winning the battle for greater awareness, greater understanding, better media coverage of the issues. But what that's going to do, as we sort of tear down the walls of the stigma and the taboo, I worry that's going to create an even greater demand for services which then people are going to find aren't there. And that's not just in Zimbabwe and Sierra Leone and Ghana, that's in the UK and in France and Germany and everywhere else. So we're making strides, but actually there's a danger that at the end of that, people are going to get even more disillusioned, even more disappointed, because they'll find the services weren't there. So we have to make sure that the services are there. And you're only going to do that if you can persuade the policymakers that that is in their interests economically as well as morally. So breaking down figures like, I mean, I never quite know how we get to these figures, 4% of the world's GDP, You have to get to that, but then you have to find ways that you can make that a compelling argument, and you have to take that argument out. And the other thing is another kind of word of advice about how you deal with governments and how you make change happen. You must never, ever, ever, ever tire of saying it. You must never, ever, ever stop campaigning. And I have a kind of golden rule of strategic communications and campaigning. Just at the point where you, as an expert who knows what you're on about, is getting sick to death of talking about something, that is the point at which there's just the outside possibility that it's reaching the outer rim of public consciousness. And most people, that is when they give up. Because they think, I've gone on about this, nobody's listening. But just think of a few things that have changed. I'll give you an example. I love this example because it's kind of it's almost random. So here we are, we're in a building where people work. And the British government has passed legislation that if you're in a building where people work, you can't smoke. Okay? If this meeting was happening 10 years ago, some of you would be smoking by now. If it was happening 15, 20 years ago, I'd be smoking by now. And that's just the way that it was. And I don't know if you know, are there any Irish people here? This story, you might know, but this whole thing, and the fact that that change has now happened in about, 100 countries in the world, it started in Ireland. Ireland, a drinking culture, a smoking culture, and the Irish government took a risk. And Tony, we were thinking about it because the smoking campaign groups were saying, this is one thing to do. We were thinking about it, and Tony Blair, let's admit it, quite likes big, bold decisions. But he actually said on this one, let's see how it goes in Ireland. And how did it go in Ireland? It went fine. Bit of protest, but not much. And so that's an example of where something that actually doesn't cost any money at all has probably ended up saving more lives than a lot of new hospitals being built. So that's, like I say, that's an economic argument you can then make for a change that you want to make happen. We can save your health service money by getting fewer people to smoke, and you'll have fewer people smoking if actually you make a cultural change. And we need to do things like that in this sphere now. I'll give you another example, gay rights. I don't know if any of you have seen the film Harvey Milk about the gay rights campaigner. So there's a guy, starts the film being beaten up on the streets of San Francisco because he's gay, and that's what happens to gay people in San Francisco at that time. End of the film, he's on the steps of Congress, he's a hero, and he's an elected representative, and they've just passed the first piece of American gay rights legislation. The reason why I love it as a film is because on that narrative arc, you cannot tell where the change came. Where did the change come that had him being beaten up on the streets at the start and fated as a hero at the end? It didn't come with the passing of the legislation. The legislation was a consequence of the change. It wasn't a product of the change. So on this, great, George Osborne stands up and says, more money for mental health. David Cameron stands up and says, I am the first Prime Minister who's ever made a speech solely devoted to mental health. Great. They are responses to change. They're responses to campaigning. So all the governments in the world that annoy you, that irritate you, that do things that you think they shouldn't, you're only going to make them change if you decide to make them change and if you then organise to make them change. And you're all in the same, I've seen the list of all the people in the room. You're all in the same sphere-ish, okay? But you're all doing very different things. And you're working for different organisations, and some of you will be very competitive. But actually, never lose sight of the fact that we do have to kind of all do this stuff together, because you make change by joining up dots over time. And the dots have to come from big and powerful arguments, because it's only big and powerful arguments that are going to make governments change their minds. And governments will change their minds, as I related in the smoking thing, because other governments change their minds, because campaigns, because movements develop. And I think you have to think of this as a movement for change. We're trying to change the way that people think so that mental health is no longer the world's forgotten crisis, but is at the heart of policy making, of spending, of decision making. And as I say, the moral case, overwhelming to anybody who knows anything about this. The economic case is makeable, and I think that the paper that Jessica has put before you today will help us all go out and do that, and let's get all schmaltzy, make the world a better place. Thank you. Thank you very much.
Alastair, that was brilliant. Thank you so much for that. Before I pass on to Jessica, can I just ask you one? I mean, since we've got one of the best strategists in the country here, that when you were in government, there were quite a few really transformative things that happened on development. The decision was taken that Britain was going to play a leadership role in developing the Global Fund, which 2 years before that happened, no one would have said it's likely to happen. I mean, it actually happened pretty quickly. Similarly with Gavi, the vaccines initiative. And then we had all the big, the Glen Eagles moment of putting all the aid commitments, which, have now become part of the broader political consensus. So, I mean, the question I'd like to put to you is, from the perspective that you've got from being in government at that time and listening to the debates that are going on, what's the type of case in this area that would have resonance in a way that would produce that sort of transformative shift?
Well, you see, I think on that, that's a really complicated question, but on the government side and on the campaign side, you have to make it simple. So, for example, you had a government being elected in 1997 where all the key people in that government were out there publicly saying, this is going to be a big thing for us. Now, lots of politicians say lots of things, okay? So you have to test it. And once you've tested it, you then have to keep pushing on it. It's funny, the last, my last book, it's about winners in sport, business and politics. But actually one of the people I talked to, it was Bono. Because, he's a winner, he's a showbiz, icon and all the rest of it. But also he's used that fame and his beliefs to get into this space. And he's actually, I think, achieved an awful lot. People can take the mick out of celebrities doing what they do. I think Bono's one of the best. And I'll never forget at the G8 in Cologne, I can't remember what year it was, but Tony was recently elected Prime Minister, a couple of years maybe. Helmut Kohl was German Chancellor, maybe not as big on development as Tony was, but, reasonable guy. And Clinton was around and he was good on this. And so Tony's kind of trying to get all the pieces, the jigsaw sort of put together. And Bono and Bob Geldof came over to see us in the hotel, and Tony had some bad news for them, which was basically that Kohl had been got at by somebody, we didn't quite know who, but one of the things that we thought was going to happen wasn't going to happen. And Bob Geldof, I don't know if anybody's ever heard Bob Geldof swear, but it's quite impressive. And he went into an absolute kind of blinding rant. And Bono, who was being the kind of calmer guy, Tony says, look, Bob, just listen, please. We're looking at a mountain. We're looking at Everest. No, we're looking at a big mountain here, and it's just we're going to have to climb it in stages. We're going to have to go, we just can't get to the top all at once. And Bono came in, he says, Tony, you're a bit like me. If you see Everest, you don't look at it, you fucking climb it. And I just thought that was a brilliant mindset. In other words, he knows Tony Blair wants to do the right thing, but he's not letting him off. He's not letting him off, and he's basically saying, I'm going to keep at you and keep at you and keep at you. So you have to, when I talk about understanding a government's big picture, so there's Cameron, Prime Minister. I'm not a big fan, but he comes out 0.7% of GDP on development, and he's under quite a lot of pressure to welch on that. He could probably win himself quite a lot of support, not least within the context of the European referendum, if he suddenly said, actually, we're going to go back on that. You've got to hold feet to the fire. And you've got to do it all the time. All the time. People have to, don't see them, they're not bad people, most politicians. I mean, some are, but most are not bad people. They just don't all believe the same thing as everybody else does. So on something like now, with this government, and actually with governments around the world at the moment, I do think that we've got to move away from this idea of it's all touchy-feely and it's all let's care for people. You've got to do that because that's what motivates us. But you've actually got to win an economic case.
Okay, thanks very much, Alastair. Actually, there's a couple of things for me that come out of this, which is, first of all, the importance of the coalition. That none of us are going to achieve this working separately, and we actually need to be way better at working together, and the research community, NGOs. And the second big take-home lesson, I always think when you come to ODI, you learn something new. And we've learned today that Alastair is not a huge fan of Jeremy Hunt or David Cameron. So let's take home a couple of take-home messages for you there. And while you reflect on that, I'm going to pass over to Jessica.
Thank you, Kevin.
Thank you.
I'm just trying to get my slides working. Great. Thank you very much. It's great to see so many people here today. That is just wonderful, really revitalizing. So we all know that, can everyone hear me, by the way? Yeah, so we all know that 1 in 4 people will suffer from mental health disorders throughout their lifetime. And we know that that places a huge cost on the healthcare systems, the global economy, and it's affecting some of the world's most vulnerable people. We've talked about that today. Also, the shortfall of services mean that millions of people are being left behind in terms of treatment. But in 2015, the world took this huge step forward. We included mental health in the Sustainable Development Goals, which set the agenda for development for the next 15 years. And that's quite a shift because, as many of you probably realize, mental health was left out of the Millennium Development Goals, which went before. which was a real shame. Similarly, we've seen 194 countries sign up to the Mental Health Action Plan, which is organised by the WHO, who we thankfully have here in the room, who are behind most of those statistics, like the 4%, which Alastair mentioned and I'm sure can explain. And this means that for the first time we have agreement on what needs to be done, who needs to do it, but not who's going to finance it. So President Jim Yong Kim of the World Bank said last month, this is not just a public health issue, this is a development issue. We need to act now. I was commissioned by one of the very few funders working in this area, Grand Challenges Canada. Thank you very much, Peter Singer, who were working with the WHO and the London School of Hygiene, who are also in the room today, to write a report on exactly this topic. And my co-author, Christy Kessner, is online joining us, I believe. Please, there are copies outside. Please take one, share and promote it, if you would. That would be wonderful. What you need to know is that it has 3 chapters. The first looks at who's currently funding mental health, and that includes who isn't and what's actually missing. The second chapter looks at why this needs to change, and now. And it presents really straightforward arguments on the fact that there's momentum. It makes economic sense. It helps development programs to deliver their programs more effectively, which we'll hear more about from Dixon later on as well. And also that the solutions can be really cost effective. This doesn't have to cost the earth. But probably the most important chapter is chapter 3, which looks at who could fund mental health in future. And it goes through 3 categories. It looks at existing funders that we could be asking more of, the donor agencies, the foundations working in this area. It looks at attracting other more conventional health players who are working in health but haven't touched on mental health, bringing them into the fold, the likes of the Gates Foundation. And it looks at less conventional players, people that perhaps the health sector hasn't really thought of engaging so much. It looks at philanthropists and private sector foundations and innovative financing mechanisms. It goes through a list of those. So this is the report cover. I want to just take you through 3 quick ideas from the report. The first, it is incredibly expensive to ignore this. The World Economic Forum estimates that mental health disorders will cost the global economy $16 trillion over the next 20 years. What a waste. At a time when we want to be promoting our economy, we simply can't afford this. We also know that it's desperately underfunded. So here I'm going to show you the comparative disease burden, which Kevin mentioned earlier. That's looking at how many healthy years are lost to either disease or death. Let's look at HIV. 81.5 million healthy years lost. We're looking at 2010 here. How many healthy years were lost to mental health? 183.9 million. Now, how much was, that's more than double, well over double. How much was spent on HIV that year? 6.8 billion. And how much was spent on mental health? A measly amount. The reason there's no figure there is that it's really hard to say precisely because donors don't actually track their funding to mental health, which is something that they absolutely must start doing, which is one of the recommendations for the report. But look, what we do know is that it was about 1/50th of the funding. So we're talking about double the burden and 1/50th of the funding in 2010, and that was a good year. Granted, HIV have very high fatality rates, and I'm not suggesting in any way that HIV should deserve any less funding, rather that mental health deserves parity of esteem. It receives a fraction of what is needed. So authors Gilbert et al. Wanted to answer this question about how much is spent on mental health. They went to the most reputable source that there is, luckily for me in 2015, so we could draw heavily on this work in our report. They went to the Development Assistance Committee Creditor Reporting System. That's about the best source we've got. For those of you who don't know much about this, that's where donors go to register their spending on aid. On average, guess how much is spent on mental health in all developing countries by all donors? 133 million. That's across 148 countries, which means that any one of them receives a fraction of that, less than 1 million for an entire population. And that's less than the UK spends on takeaway coffee in 1 week. Let's just have a look at that. And just to provide another contrast, it's less than half of what the US spends on Halloween costumes for their pets in a year. Not to make light of a serious issue, rather the opposite. So the report looks at the fact that there are successful models for mental health programming, that you can measure progress. The metrics exist and an evidence base is being built thanks to these pioneering funders. So I guess the question that we'd probably like to answer is how much exactly is needed. In 2007, the world experts, the Lancet Global Mental Health Group, got together and said that as a minimum, for a bare package of mental health care, you would need $2 per person in low-income countries. So you can see the green bar at the top. That's a bare minimum package of care for low-income countries, the poorest countries in the world. Underneath, you can see in orange, that's how much is currently being spent by both the developing country governments, 20 cents, and then underneath you have the 5 cents spent by donors per capita. So altogether it makes 25 cents. So we have to find this remaining $1.75 somehow. In middle-income countries, the figure is $3 to $5 per capita per year. This is annually. And just to provide a contrast, the UK currently spends $278 per person per year. 278 versus $2 is what we're talking about. And that's considered not nearly enough in the UK as well. So I was just interested with my co-author, Christy, on how much this actually adds up to. If we wanted to look at a shortfall for just the basic the basic package of healthcare for the low-income country populations. And if you do some simple maths, it comes to 1.08 billion. So that's looking at $2, well, 175, the remaining figure, multiplied by the populations in the LIC group. So how do we get funding to flow to this area? Well, the report doesn't have all the answers, but it does try. What it does is it breaks down the different groups that are operating. It looks at development agencies and bilateral donors like DFID, DFAT, USAID, CEDA. It looks at the development banks, it looks at the multilaterals, it looks at foundations, NGOs, INGOs, philanthropists, private sector foundations. And then for each of those groups of actors, it looks at why they're not funding mental health. And it diagnoses roughly 4 categories. 1, they don't know enough about mental health, either the extent of it or the negative effects or the economic costs. 2, that other issues always become more of a priority. 3, they believe that the metrics are weak and they often need to show results really quickly to their stakeholders. And this is particularly true of NGOs. Or 4 might be stigma. So it goes through and it presents different arguments for framing mental health to these groups depending on what's stopping them. And it looks at different entry points over the next 3 or 4 years. But the difficulty of answering, as Alastair sort of foreshadowed, who isn't funding mental health but should be, it's tricky because the answer is everyone. So what you have to do is prioritize and sequence and tailor those messages accordingly, which is what the report sets up to do. But beyond all of the statistics I've gone through today, if you remember nothing else, I just wanted to say it's about acknowledging as an international community that this matters, that there are people who are suffering and need help, and that there are ways of helping them that work. It's just that we're not able to get those types of help to most of them currently, and that desperately needs to change.
Jessica, thank you for that, and please do pick up a copy of Jessica's reports. And I know I would say this anyway, but it happens to be true. It's an absolutely fantastic report, so please do take a copy and read it. You know, as you were speaking, I was just reflecting on a couple of things. That it's interesting that the arguments that you've outlined, that donors, you know, they want results, they want to be able to point to cost-benefit numbers. And that's the message that we constantly get. But I wonder how true it is, actually, because if you look at many of the areas that donors invest very heavily in, economic growth, corruption, institution building, actually the evidence on that is pretty shaky, to put it mildly. And so I think, in a sense, there's a political choice. These are political choices. They're not. There's a sort of pretense that it's driven by evidence, but in many cases, it's a straight political choice. And it seems to me that's where it comes back to Alastair's point. That there's so much of this issue that is wrapped up with ideas about stigma and shame and stuff that we would rather sweep under the carpet. And it's, unlike immunisation, it's complicated. With immunisation, we can point to a direct result. Here, the numbers might be big, but it's difficult. And I think what you've set out in this report, it's really in embryo a sort of agenda that we could all get behind. These are sort of practical, achievable, deliverable, but they're not going to happen without a campaign, actually, which I think brings us back to the coalition and the advocacy part of the story. And we'll return to that in some of the questions that we deal with after. So if I could turn now to Dixon, so the report set out some of the big financing gap issues, but I think what would be great for us, if you could just start maybe by giving us a sort of feel for what this issue looks like from your perspective in Zimbabwe.
Sure, thank you. So I think I'd like to start off by just emphasizing that the treatment gap for mental, neurological, and substance use disorders is massive in sub-Saharan Africa, not just in Zimbabwe. You're looking at a ratio of about 1 psychiatrist to over 1 million of the population. And that's very big, obviously. And what has been happening in a lot of the sub-Saharan countries is we're increasingly looking at task shifting as a way of reducing that treatment gap by using community health workers or non-professionals, so to speak, to provide the bulk of those services. And in Zimbabwe, over the past 10 years, we've kind of made quite a lot of progress working with lay health workers to reduce the burden due to common mental disorders, which include depression and anxiety disorders. And we're currently in the process of scaling up a program which we call the Friendship Bench to over 60 primary healthcare clinics in the country. So that's where we're at the moment.
So tell us something about the Friendship Bench project.
So the Friendship Bench is a brief psychological intervention which is delivered by lay health workers who are trained and supervised by clinical psychologists and psychiatrists. And the whole idea is for these lay health workers to provide this structured cognitive behavioral therapy-based intervention, which includes behavior activation, activity scheduling, with an emphasis on problem-solving therapy. And it has resulted in really a shift in policies with regards to mental health. For instance, the City Health Department has currently allocated a budget for the first time towards mental health. So for us, that's a real achievement. So the Friendship Bench has managed to contribute towards some policy shift toward about mental health. Yeah.
Can I just ask you that? It's actually the Zimbabwean variant of what Jessica. So Jessica was setting out a picture that this isn't an issue that donors have really grasped the nettle on. There's not a sort of political impetus behind it. And I think there's a recommendation somewhere in the report that government should be spending 10% of the health budget on, or maybe I picked that up in the Lancet. I can't remember. But if you went to the Minister of Health in Zimbabwe and said, look, this is a major national health concern. We should be spending a far bigger chunk of the health budget, whatever the number, 8%, 10%. What's the sort of response that you would get?
Well, lately, because of all the advocacy that's been going on, the response has been positive. And I think it largely depends on how you sell mental health. And the way we've been selling mental health is to emphasize the fact that by integrating mental health packages in the existing programs, you will actually improve outcomes of those programs, whether it's HIV, maternal and child health, or its other key non-communicable diseases, such as diabetes, hypertension. And that seems attractive both to the city health department and the Ministry of Health. So that's our key selling point, and we have the evidence as well to sort of support those statements from research carried out in the country and in sub-Saharan Africa as well.
And could you maybe just say something about the cultural context, the way that mental health issues are viewed in the public domain, if you like?
So, that's a very important question, because a lot of the terms that are used in the Western world to describe specific mental health conditions do not exist in Africa. For instance, we don't really have a word for depression. So what we use in Africa is the equivalent of thinking too much, which in my language, Shona, means kufungisisa. So I think what is critical is being able to strike that balance between ethic and emic factors, in our understanding of mental health, and being able to use appropriate indigenous idioms of distress to get across to people. And I think that's really the key selling point at community level. People need to understand mental health from their own perspective, and then bring in the biomedical model to address the challenges.
Dixon, thanks very much. We'll pick up some of these points in questions after. Let me turn to Fode now. So, Fode, as I mentioned before, I mean, obviously Sierra Leone has just come through this very traumatic experience with Ebola. And a lot of the response has actually been, in a sense, a traditional public health response. But, I mean, could you just give us a sense of what impact that has had on the mental health domain?
Thank you very much, Kevin. Maybe before I talk about the impact Ebola had on the public health system, it's good to give us a small background, like Dixon was saying. In terms of figures, the pre-Ebola situation of mental health was that we had only one retired psychiatrist in the whole population of about 6 million. We had 20 mental health nurses who had just really been trained not very long ago. When really I came on board, I really championed this thing, and we started moving. We had 4 child health adolescent nurses, also recent graduates. And the psychiatric hospital had only 3 trained personnel. The others were mental health nursing aides, trained mainly to restrain patients and to dispense medicine. So that's the situation, in terms of manpower capacity. It was really very bad. Now, coming back to the impact of Ebola, one of the most prominent, outstanding situation was when a mental health nurse contacted Ebola. She contacted Ebola, and she became, almost blind. When she came out from the treatment center and went back home, she found an ejectment notice waiting for her. Stigma. No, you can't stay in this house because, you're an Ebola carrier. But maybe to explain a little bit as to why those figures. First of all, the policymakers really do not understand this whole issue of mental health. They just do not really understand. And so until, knowledge is power, until they understand, they're not going to know how to tackle it. Culturally, it's seen more as a spiritual problem rather than something that you can treat. And, the population, too, do not understand. And because of all of this, psychiatry and, psychology, it's not a sexy area for, medical students to go into. And so that's what is bringing all of this down. But thank God, the understanding is coming back. Then the other impact is that, we have, about 4,000 people died. and there are about 4,000 survivors. All of these, the 4,000 people that died, they have relatives, friends, neighbors, and all of that. The 4,000 survivors that are remaining, that are living within the community, they also have relatives and all of this. All of this put together are at a much higher degree of being affected by this whole problem at various degrees of this mental health problem. And when you juxtapose that on the manpower capacity that is there to take care of them, when you juxtapose that on the availability of services, you know that there is a big problem.
And just by extension, if I could ask you, so one of the arguments in the report is that there's a sense in which we can use the SDG. The SDGs is everything, but it is the case that for the first time in one of these type of agreements or this set of commitments, we do have mental health figuring. Do you actually see this as a vehicle that can help achieve the sorts of changes that you want to see in Sierra Leone? And if so, what's the type of campaigning, the advocacy that we need to deliver on that?
Well, first of all, I do agree personally, having been in government, that it is the responsibility of government to take a leadership role. When they take leadership role, they really demonstrate commitment that this is a problem and this needs to be handled. It goes a long way. If not, if it is the partners, the NGOs, and the other members of the international community that are taking leadership, you will find out that, first of all, the services are not equitable because people like to go where they feel comfortable. It cannot be, the geographical spread will not be very good. But I want to believe very strongly, especially based on all the advocacy that has been going on, in the last few years, that, well, I'm talking my heart, that this is going to change the way that government is going to address this matter, especially when it's now in the SDGs, so it becomes really everybody's business. Now the government must know that, this is the international community is taking it seriously. It's a means of advocacy. But there are two things that I think must happen. And when I was, championing mental health in government, we were pushing for two big things. First of all, we were saying that the Ministry of Health must have a mental health coordinating unit. The with that coordinating unit, it will provide the much needed leadership with the knowledge, the skill, the understanding. And then they can now be able to coordinate all the other partners in the business. It will show that government has prioritized this. It will show that government means business. And so, you put your money where you put your mouth where your money is. So when government is showing leadership, is showing commitment, the other partners will take it seriously. So we will continue to push. We've gone a long way to push for this coordinating unit. And secondly, we have been pushing for government to really have a budget line item. The mental health budget is hidden under non-tropical, they call it, non-communicable diseases. It's just hidden there. And we fought to get it out from there and put it as a budget line. But we are now going to point to the SDGs and say, look, the whole world is taking this seriously. We must take this seriously. And when we have this budget line and we really commit some money to it, then we can now have the moral integrity of turning to all the partners and say, look, this is serious. Let's go ahead. So just in summary, it should change the way we are doing business. But to do this, we need that coordinating mechanism within government. And secondly, we need not only to have a budget line, but for us also to put money into that budget line.
Okay. But actually, before I throw it open, I just want to ask both of you one really brief question. Thinking back to the HIV/AIDS trajectory, there was a critical moment, I think, for the whole of sub-Saharan Africa, where, if you remember, Nelson Mandela stood up after the funeral, I think, of his nephew, and basically said, "We need to talk about this. There are attitudes, there are social attitudes that we need to challenge very directly." And I think many of the issues that have the biggest blockages in development, early marriage, and other sorts of issues. They raise questions about social attitudes. Who do you see in Africa now who is really championing this issue? Standing up, making a difference. Present company accepted, obviously.
Well, you mean all of Africa?
Yeah, like who are the figures that are the figures of international standing, the Africans of international standing who are really taking this issue up?
Well, in Sierra Leone, it's me.
I did say present company accepted. But it's a good answer. Dixon?
I don't know if there's anyone at the moment.
That's what I'm thinking.
But I think
Yeah.
so. I think with mental health, our strength in Africa really lies in the communities, because the communities are living with mental health on a daily basis, and I think that's where the solutions should be coming from. We don't necessarily need a key figure to drive the change. The communities are doing it, and probably that's all we need.
Okay, thank you. So I'm going to throw it open now to public debate. I've got a couple of questions that I want to invite before we have the broader discussion. The first is from Dan Chisholm.